Autism is a neurodevelopmental disorder. It affects communication and social interaction. People with autism may have repetitive behaviors. Autism is a spectrum, meaning it affects people in different ways. Some people with autism need little support. Others need a lot of support. Early diagnosis of autism is important. It helps people get the support they need. Early intervention can improve social skills, communication, and behavior. When autism is diagnosed early, individuals have a better chance of reaching their full potential. However, not all individuals with autism are diagnosed early in life. Some individuals are diagnosed later in childhood, adolescence, or even adulthood. This is known as late diagnosis. Late diagnosis can have significant implications for individuals, families, and society as a whole. Late diagnosis of autism can occur for a variety of reasons. One reason is a lack of awareness and understanding of autism among the general public and even some healthcare professionals. Autism presents differently in each individual, making it challenging to recognize. Another factor contributing to late diagnosis is the presence of co-occurring conditions. Individuals with autism may also have other conditions, such as anxiety, ADHD, or learning disabilities. These conditions can mask the symptoms of autism, leading to a delayed diagnosis.
Access to healthcare services also plays a crucial role in diagnosis. In some areas, there may be limited access to specialists trained in diagnosing autism, such as developmental pediatricians, psychologists, or psychiatrists. This limited access can result in significant delays in diagnosis, particularly for individuals living in rural or underserved communities. Furthermore, cultural and societal stigmas surrounding autism can prevent individuals from seeking a diagnosis. Some families may be hesitant to acknowledge the possibility of autism due to fear of judgment or discrimination. This reluctance to seek professional help can further delay the diagnostic process.
Late diagnosis of autism can have profound consequences. Many have struggled for years to understand their differences. They may have faced academic difficulties, social isolation, or employment challenges.
The realization of an autism diagnosis later in life can bring a mix of emotions. Some experience relief as it provides an explanation for their struggles. It can be validating to finally understand their unique way of thinking.
Early intervention is crucial for children with autism. It helps them develop skills and reach their full potential. Early intervention programs provide individualized support based on the child's needs.
One of the key benefits of early intervention is its focus on developing communication skills. Children with autism may have difficulty with verbal and nonverbal communication. Early intervention programs use various techniques, such as speech therapy and picture exchange systems, to help children improve their communication abilities. Social skills training is another essential component of early intervention. Children with autism may struggle to understand social cues, engage in reciprocal interactions, and build meaningful relationships. Through play-based activities and social stories, early intervention programs teach children appropriate social behaviors and help them develop social skills. Early intervention also addresses challenging behaviors that some children with autism may exhibit. These behaviors can include tantrums, aggression, or self-injurious behaviors. Early intervention programs work with families to develop strategies for managing these behaviors and promoting positive alternatives.
The power of early intervention. Shaping a positive trajectory. Early intervention plays a vital role in shaping a positive trajectory for individuals with autism.
By addressing developmental delays and providing tailored support, early intervention empowers individuals to thrive. These gains can have a lasting impact, enhancing their ability to succeed academically and socially.
Early intervention can reduce the need for intensive support services later in life. It promotes greater independence and self-sufficiency, leading to a more fulfilling and productive life. Section 6. The emotional impact of late diagnosis, a journey of self-discovery. Receiving an autism diagnosis later in life can be an emotionally complex experience. It is a time of profound self-reflection and understanding.
The diagnosis can bring a sense of validation, explaining lifelong experiences and challenges. Individuals may reflect on their past, recognizing patterns and behaviors. They may recall feeling different or socially isolated.
Late diagnosis can evoke feelings of grief and loss, grieving missed opportunities and support. Acknowledging these emotions allows for healing and acceptance. Section 7. Supporting individuals with late autism diagnosis, a multifaceted approach. Supporting individuals with late autism diagnosis requires a multifaceted approach.
Creating a supportive environment is essential. Access to mental health services is crucial. Vocational support is another critical area. Social support groups connect individuals with shared experiences.
Language barriers can also pose a significant challenge for families seeking autism diagnosis and services. Providing translation services and culturally appropriate materials can improve access to information and ensure that families understand the diagnostic process and available support. Furthermore, it is crucial to address the stigma surrounding autism in some communities. Educational campaigns and community outreach programs can raise awareness about autism, promote acceptance, and encourage families to seek early intervention services without fear of judgment or discrimination. One significant barrier is the lack of culturally competent healthcare providers. Autism can present differently across cultures, and healthcare professionals need to be aware of these variations to make accurate diagnoses. Increasing diversity within the healthcare workforce and providing cultural competency training can help bridge this gap. Section 8. Breaking down barriers, improving autism diagnosis in underserved communities. Efforts to improve autism diagnosis rates must address the disparities that exist in underserved communities. Factors such as socioeconomic status, race, ethnicity, and geographic location can create barriers to accessing timely diagnosis and intervention services. Empowering communities to recognize autism. Education and awareness promote early diagnosis and acceptance of autism. Increasing understanding creates a more inclusive environment.
Schools are essential for autism awareness. Educators need training to support students with autism.
Public campaigns spread accurate information and promote acceptance. Section 10. A call to action. Advocating for timely diagnosis and support. Addressing the issue of late autism diagnosis requires a collective effort from individuals, families, communities, and policymakers. We must advocate for timely diagnosis, accessible support services, and increased awareness and acceptance of autism.
One crucial step is to advocate for increased funding for autism research, diagnosis, and treatment. This includes supporting organizations that provide resources, training, and advocacy for individuals with autism and their families.
We can also make a difference by supporting legislation that promotes early intervention services, protects the rights of individuals with disabilities, and ensures access to quality healthcare and education for all. Furthermore, each of us can play a role in creating a more inclusive and accepting society for individuals with autism. By challenging stereotypes, promoting understanding, and embracing neurodiversity, we can create a world where everyone feels valued and supported. Section 11. Conclusion: embracing neurodiversity and fostering inclusivity. Late autism diagnosis highlights the importance of early identification, intervention, and support for individuals on the autism spectrum. By understanding the reasons behind late diagnosis, addressing the consequences, and advocating for improved services, we can create a more inclusive and supportive society. Embracing neurodiversity means recognizing that autism is a natural variation in the human brain and that individuals with autism have unique strengths, talents, and perspectives to offer the world. By fostering inclusivity, we can create communities where everyone feels valued, respected, and empowered to reach their full potential. Let us work together to create a world where autism is understood, accepted, and supported, and where individuals on the spectrum have the opportunity to thrive and make meaningful contributions to society.